I guess I wanted to start out by saying that I wanted to extend my heartfelt condolences to anybody that was directly affected by Hurricane Sandy. I guess the reason that I'm here is after Hurricane Katrina, which struck September the 29th, and I guess I can advance the slides here for you. I'm sorry, August 29th of 2005, I was working as the dental director for the Mississippi State Department of Health. The next day, we had no communication with shelters that we had set up on the Gulf Coast. And so we took a van, loaded it with some cereal and dry milk from our WIC shelter, storage unit, and then headed down. So I'm going to share those experiences and lessons learned today. The goal is to give you an overview of how an incident command works at the local, state, and national level, share my personal experiences, and try to help guide you through your planning as you move forward. It's important, I think, for us to have these stories because they're testimonials, and to be in Manhattan where 9/11 occurred, which I think kicked off the national strategies and really helped to educate and reinforce what we are doing now before Katrina. So this is the pyramid. The response begins locally, as Dr. Klein mentioned. The first lesson learned is you need to know who to work with locally. And typically, it's the local mayors, the head of the police department, the fire department. Those are the individuals that are responsible for getting things ready. There's also, in most states, if not in all states, a state emergency management agency. And those individuals will be deployed to begin working with the local leadership. The state becomes involved when the local resources become overwhelmed. And the states do have state incident management plans. And one lesson from Katrina is that most of these plans did not have any non-allopathic health services involved in the planning. So, for example, the veterinarians and the dentists weren't directly involved in these plans. The local group informs the state, and then the state, through the governor, implements a declaration of emergency. And then that's when the federal resources begin. And I know we've had some recent candidates for president that kind of alluded to maybe giving the states more support, but that's the whole point of this. The states become overwhelmed and they require the federal support, but the feds don't come in until they're asked. So what happens in the state response? Well, the first step is to make sure that people are safe and to search and rescue for survivors and provide shelter and provide food and water. The different agencies in state contribute to different portions of that. The health department, for example, typically will set up a shelter for people that are unable to evacuate that have special health care needs. But they are not typically responsible for setting up all shelters in the affected areas. The shelters are typically also set up in advance before the storm hits so that people can go and prepare. So the federal response is authorized through the Robert Stafford Act, Disaster Relief and Emergency Assistance Act, and it gives the federal government the authority to provide the recovery assistance. But it's important to note that this assistance isn't entirely federal. It's shared, the cost is shared with the state. And as you just saw, these are the 4 stages of the plan. Of the response, of the crisis response. Now, I didn't know what a mitigation was before Katrina. I don't know if a lot of folks knew exactly what that is, but it's anticipating risks to your families, to your livelihoods, to property, and anticipating those risks and trying to eliminate and mitigate those risks. There are structural things that can be done. For example, protecting levees. And another thing is if you're beginning to set up a medical practice or a dental practice, anticipating floodplain by looking at maps to see if you need to do some design to help mitigate a flood inside the office, so raising the office or finding a different location. And then there are non-structural, which includes obtaining flood insurance. So in terms of preparedness, this was the Biloxi High School. This was one of the 2 special needs shelters that the Health Department of Mississippi set up prior to Katrina. This, I think, on Sunday, before we started to lose communications when the storm came through, my understanding is there may have been about 200 or so people that were residing in the shelter. And then the storm surge hit, and communications were lost. Most of the people in the shelter were people that required some kind of medical assistance, for example, hemodialysis or frail elderly. And these were nurses from the health department working at the shelter. And I've circled the pole in the back because that's notes people were putting up trying to look for their family. Again, communications were down. One preparation piece that was also just mentioned, really important to reinforce, is to have phone lists available of cell phones, because texting did work. Cell phone coverage did not work well, but text did seem to get through for some reason. And you want to have that for your staff, for your family, and possibly even patients. One thing that struck me after Katrina is that there was a question of the legal relationships when a practice is down for some time. If a patient felt like they were being abandoned or that they could not contact their provider, what possibly would be ramifications from that. So the governor makes the disaster declaration. The state, through its emergency management agency, establishes an emergency operation command. And then each state agency has its own command center. We had our own command center at the state health department. I didn't learn about that until probably about 10 days later, because the first week I was in that shelter on the Gulf Coast. So food and water are the first key things. You've got to get that. This was one of the halls in the high school, and most of what we did was just bring in boxes and set them up. There's always logistical challenges, and as Steve Kess noted, it's so important for leadership to be present at every level of a crisis response. And you have to be intuitive and just do the right thing, because you'll take these incident modules and you'll learn some of the basics. They're set up almost like cookbooks with chapters, and you go through each one. But to be able to lead on the ground is really the key. Another lesson learned, however, is some people send stuff, like used clothing and a lot of things, that maybe shouldn't be sent in the initial phases. Within the first 7 days, the key is food and water. Batteries, things that would be meaningful during the immediate phase. We did require things like shoes, and one of the more interesting things is denture adhesive. We got donated toothpaste and toothbrushes, but we didn't have any denture adhesive, and we had a quite sizable number of patients in a special needs shelter where you have elderly who could not wear their dentures. Again, the key is to organize the supplies, to get them to the folks who need them. And this is all happening within the shelter. This is not taking into account getting the supplies outside, which typically will happen at about 5 to 7 days. And volunteers begin setting up these tents. This was in the parking lot of a Kmart. And volunteers came in and set up food kitchens where they were distributing sandwiches to people. So, one huge lesson is, why were there so many people here in these areas? And so, as I'm assuming happened here, people don't really evacuate long distances. They go maybe 10, 15, 20 miles, and then after the crisis is over, they want to come back and see what happened. And in these days, the police didn't really keep people out that well. I'm assuming that's a little bit different because of lessons learned. So the next thing is the response, and the first step is damage assessment. It's key to work again with the local group and with that incident command to make sure that they're asking the right questions. Don't assume that the stock assessment grids, where they go, basically canvass neighborhood by neighborhood, are going to include the right questions. And all this should be done in advance by working with incident command before a crisis occurs. We also had universities that sent students into these areas to do needs assessments. And another lesson learned was that we could actually add questions to their tools. So there are opportunities to ask the right questions when these assessments are done. So this is the Biloxi Gulf Coast area. The circle indicates a medical facility. And in this initial assessment, the goal is to see what the extent of the damage is, what's the impact on the healthcare infrastructure. In our case, all of our hospitals were damaged, and that was the priority. But we also learned that many of our dental offices were damaged. In fact, 85 dental providers on the Mississippi Gulf Coast, which isn't that big. You know, one county has 45,000 people, Hancock County, and the other, I think, has maybe around 150,000 or something. But 85 dentists experienced office damage, and 44 dentists lost their homes. Now, the State Dental Association started to collect this information because they were trying to see what happened to their members. But then this becomes very useful information for us in the state agency. And the American Dental Association, probably through the work of the foundation, was able to create these maps where you could actually see who is affected. There's a little bay area, if you can kind of see towards the left under Hancock, and that happens to be Bay St. Louis, and that's an area where a lot of people have vacation homes, and a lot of wealthier people actually live around the bay. The bridge was destroyed crossing the bay. So what we learned in our preliminary damage assessment is that the folks on the left side were probably more needy than the folks on the right, because the folks on the left basically could go to New Orleans, which was even more traumatized in some ways due to the flooding. So the State Health Department operates under Essential Support Function number 8. This is led by the Secretary of Health at the national level and through the Department of Health and Human Services. They engage the U.S. Public Health Service, and then they work with the state health departments to implement plans to help restore basic medical services. In Katrina, there was a misconception that trauma would be the main need after the storm. What was clearly the main need was primary care, and that was because most people lost their prescriptions, their actual bottle pills. They didn't take them, or they lost them. And in one case, the VA medical center actually mails the medications to their beneficiaries at the end of the month. So all of those pills were completely gone in some post office that was destroyed. So primary care was actually the main thing. And as I said before, non-allopathic services were not included. As part of this ESF-8, North Carolina sent its state medical assistance team called Carolina Med 1. They set up a mobile hospital, and the trailer in the center is actually an anesthesia suite. And I can tell you, it was probably used maybe a few times, but not a lot. And if it was used, it was probably used more for individuals who were part of the recovery. The volunteers that were coming into Mississippi and participating in the debris removal who got injured. So here is the very first dental response, and this occurred, the storm hit on August 29th, and then after I got back to the health department from the shelter, which was around September the 6th or 7th, this group in Birmingham, Alabama, called Smiles of Grace, Dr. Mark Buckner asked if he could come. And then it turns out he couldn't come. He just sent his wife with the van. So it meant that we didn't have dentists, but we had the equipment in the facility. So dentists started to come in from Illinois, from South Carolina as volunteers. And we were able to provide services. In the tent that you see out there, we had to set up portable chairs that were donated from various companies, which I'll show in a moment. And then Sullivan Schein. Henry Schein brought the Tomorrow's Dental Office Today, which was a trade exhibit unit for exhibition, and the U.S. Public Health Service provided services. I don't know if Jason Krause is here, but he's in the orange coat in the center, and he was sort of the lead for that operation. But the dentists that were providing the service were in Mississippi to do logistics as part of ESF 8, not to be dentists, not to do dental care. So you're probably wondering, well, why did this even happen? Well, it happened partly because of that damage assessment. We knew that offices were out, and we assumed that there would be people that would have toothaches. And so we wanted to make the facilities available, but there were some lessons learned. One valuable one is that because there were so many dentists who lost their own offices, that probably a better model is to try to engage them in these operations. And the only way to do that is to begin today. Dentists, physicians, veterinarians have to go and sign up. They have to sign up as volunteers. I don't know if I have that on the slide. And you can do that by registering with your state health department. There is a program where you can sign up and get the training, and then you're part of that ready response unit for the next disaster. The other thing is states have emergency management assistant compacts, which are those agreements. I think Dr. Klein mentioned that maybe it's beneficial to have reciprocal agreements between providers so that you have a place where you can see your patients and get started working again while you rebuild. And that's, I think, what this is, but at the state level, essentially. And so it's important for states to have shared resources and personnel, and that can happen through these agreements. So again, the key is to identify who your emergency management leader is within your state health department or your emergency management agency and get connected. So the key is that once the national resources start trickling into the state, there's money available to do things. And because of the TDOT being in Mississippi, we had to run the generator, purchase gas, and other things. So it's important to do an action request, which has to be done through the incident command. A lot of folks don't realize that that can be done. But based on your damage assessment and your need, the need of people in your area, you can ask that an action request be prepared. And there is a Rear Admiral who's on the U.S. Public Health Service as part of that ESF 8 response who will look at it, work it up the chain, and get it approved. And then once that happens, then FEMA will start kicking in the resources needed for these response operations. So we were able to purchase the gas. And then this is the ESSER VIP, which is the way that people can volunteer to be part of that response before a disaster. It's the Emergency System for Advanced Registration of Volunteer Healthcare Professionals. So these were the partners. The foundation, Aseptico donated those portable chairs and portable generators. The U.S. Public Health Service, Henry Schein, and the Department of Health and Human Services. And then all of the volunteers that went to the area. So this raises some issues. One that's probably in your mind is, what about credentialing? So how can somebody come from another state and actually treat people in my state? That ESSER VIP enables people to undergo the appropriate education in order to have that temporary credentialing as part of that Stafford Act. So the federal response enables that to occur. But state licensure boards need to also be involved in that state emergency management planning process. And in Mississippi, we did invite members of the State Board of Dental Examiners and the State Medical Board to be part of that process. So now the recovery phase. This was a survey that was conducted by Governor Haley Barbour. When I learned that the health staffer did not include dental offices, we raised concern over that, and they actually did include this assessment in that survey that Governor Barbour did. And so we were able to see several months later, this survey I think was done in December, we were able to see what the status was of rebuilding. Now, I think other speakers today are going to talk about the recovery phase, and FEMA and the federal resources that are available do include repair assistance, replacement assistance, permanent housing construction, rental assistance, and other things. But you have to go through the appropriate application process. You've got to figure out which one to fill out and how to do that. And I believe that there are people this afternoon that are going to help you walk through that process. So again, just to reiterate, it starts at the community level. Now is the time to get engaged in local politics so that you can become part of that planning group. The local response includes your own preparedness, creating your own personal mitigation plan. Again, the lessons are amazing. We had serious problems with gasoline afterwards because so many gas refineries were shut down, and also the wells in the Gulf of Mexico were shut down. And so here's an opportunity to say maybe we should be stockpiling gas. Maybe when this is coming, there needs to be stockpiling of gas as quickly as possible a few days before the crisis event in a secure location. And then there needs to be logistics to get it to the affected communities. Hoarding education, electricity and other things. That's kind of like the lessons here that we need to bear in mind. And then there's the state. One thing I also mentioned about the ESF-8 is that they're also responsible for identification of victims. That disaster mortuary response team is part of that as well, and typically dentists are part of that group. But they need to have access to dental records or models typically to fully identify folks. And so having those records uploaded to an application, a secure application, where they could be retrieved at a later date is probably the most valuable lesson. If it's paper only, it doesn't work anymore because those were destroyed. And then the federal, which includes the planning, the credentialing process, and then assistance with mass care, that medical response. There are all these ICS courses. They're online. Like I said, they're like cookbook. They're cold, but you should take them. The most important thing is to either volunteer as part of a medical reserve unit or to get involved in that SRVIP registration. And then finally, I'll close with a little, just brief discussion on resilience. I'm a native of New Orleans, so my family was directly affected by the storm in New Orleans. And we talked a lot about resilience. And there was a researcher here at University of Buffalo in New York State named Michael Brunel, who talked about the 4 R's. Robustness is the inherent strength that we must have in order to move forward. Redundancy, just like this rubber band, are system properties, those physical properties that allow us to seek alternate options, choices, or substitutions. You have to be prepared to do that. The resourcefulness means that we have to have the capacity and be leaders to mobilize the needed resources. Don't think solely about ourselves, but think about those that we serve. And then the rapidity is the speed with which the disruptiveness can be overcome. And I'll close on that. I appreciate the opportunity to speak to you and share some of these lessons.